Trauma is defined as the tissue injury that occurs more or less due to violence or accident, or it could be due to a surgical trauma. The response to trauma encompasses emotional stress, endocrinological, immunological, hematological, and metabolic responses, out of which endocrine and metabolic responses are mainly referred to stress response. Stress response, or otherwise known as fight and flight response, which depends on many factors like characteristic of an individual, type, and characteristic of the trauma. The term ebb and flow phases are two phases which describes initial decrease in the metabolic activity so that the energy can be conserved, and subsequent increase in the metabolic activity where the recovery and the repair occurs. Ultimately, the metabolic effect and the endocrinological changes which leads to increase in the catabolism, which mobilizes the substrates to provide energy sources and mechanism to retain salt and water retention so that we can maintain the fluid volume and the cardiovascular homeostasis. The pathway of stress responses. First, the afferent neuronal impulses from the site of injury, which travel along the sensory nerve roots via the dorsal nerve root of the spinal cord, then to the medulla, then it activates the hypothalamus. From the hypothalamus, which leads to which activates the pituitary and which acts in the end organ to release catecholamines, which increase the activation of sympathetic nervous system, which leads to increase in the CVS effects like tachycardia and hypertension, which increases oxygen consumption, decreases myocardial oxygen supply, and also increased sympathetic activity will decrease the GI motility and enhances coagulation, which leads to hypercoagulability. In detail, the endocrine and the metabolic responses are from the anterior pituitary, there will be increase in ACTH, beta endorphin, growth hormone, prolactin, thyroid stimulating hormone. From the posterior pituitary, increase in arginine vasopressin, which is the major hormone as an antidiuretic hormone, helps in salt and water retention. From the adrenal cortex, release of cortisol and aldosterone. From the pancreas, there will be increase in the insulin secretion, which is the main anabolic hormone, which decreases the blood glucose level and increases the protein synthesis. So by decreasing the insulin, we can make increase in the blood glucose level. And the cortisol and growth hormones all will result in increase the blood glucose level by decreasing the glucose uptake by the peripheral cells, by increasing gluconeogenesis, by increasing glycogenolysis in the liver. And the other responses are immunological response, mainly the cytokine release, which in turn releases the interleukin and the tumor necrosis factor alpha, which is mainly responsible for the acute phase response. In acute phase response, there will be increase in the production of acute phase proteins like CRP, fibrinogen, alpha-2 macroglobulin, and other antiproteinases and ferritin, which decreases other liver protein productions like albumin and transferrin. Features of acute phase responses are fever, granulocytosis, production of acute phase proteins, increase in the level of acute phase proteins. Other responses are decrease in GI mobility, enhancement of coagulation by decreasing the natural anticoagulants, increasing the procoagulants, and stress responses inhibits fibrinolysis and also increases platelet reactivity and plasma viscosity, which leads to hypercoagulable state, resulting in complications like DVT and myocardial infarction. A role of anesthesia in stress response is attenuation of the stress response and appropriate pain management. Extensive epidural analgesia with local anesthetic agents will prevent the endocrine and the metabolic responses. For example, in case of a chest injury with multiple rib fracture or in case of upper abdominal surgery, epidural analgesia with local anesthetic will where the patient is not able to breathe properly, not able to cough in case of chest injury or upper abdominal injury, which increases the mortality and morbidity. By providing effective analgesia, the patient can breathe properly, can have effective cough, which which improves the mortality of the patient. Other drugs we use in anesthesia helps in attenuating stress response are opioids, etomidate, benzodiazepine, midazolam, and clonidine, which also inhibits stress response, which is mediated by sympathetic nervous system. That is also.
So, what about the immunology? What about the immune response to stress? We have not talked anything about the cytokines which are released, inflammatory responses. That is also part of the stress response.